At present, the world has to encounter the problems of climate change, environmental degradation, disasters, and epidemics of emerging and re-emerging diseases, which are common health problems of many countries. For Thailand, the guidelines for responding to both groups of diseases affecting people's health have been developed, including the systems for disease surveillance, prevention, treatment, and control under the One Health concept. For example, working collaboratively in a multidisciplinary manner among officials in the human and animal health, as well as environmental sectors. Moreover, actions are ongoing regarding the development of capacity and preparedness of the management system, as well as personnel and knowledge management, for efficiently preventing and controlling communicable or infectious diseases, according to the internationally recognized standards. Role of Medical School in Disease Control, a case of Faculty of Medicine, Siriraj Hospital. For Thailand, its capital city of Bangkok has had a long history with the major Chao Phraya River flowing through the people's ways of life along the riverside that changed with time for more than 200 years. This is Siriraj Hospital, from which a chapter of Thailand's public health history has been recorded. The hospital was established in 1886 during the reign of King Chulalongkorn, Rama V, originally as a small hospital that has been operational through various stages of development. Until today, it has played a role as an important hospital of the nation and another role as an important medical school of Thailand, and become the Faculty of Medicine Siriraj Hospital, Mahidol University. The faculty currently produces public health personnel in various branches and provides medical care for the people. Medical examination and treatment technologies have been developed in response to people's health needs, based on the correct and rapid service delivery approach. This is the microbiology laboratory of the faculty's microbiology department. It is the heart of medical diagnosis. Associate Professor Dr. Pattarachai Giratisin, Chairman, Department of Microbiology, Faculty of Medicine, Siriraj Hospital, said, "This place can be regarded as the largest microbiology laboratory in Thailand. As Siriraj is a large hospital, we serve as a reference laboratory that performs more than 300,000 confirmatory tests each year in both normal and epidemic situations." Microbial diagnostic procedures are performed here every day on samples or specimens with bacterial, fungal, and viral infections in humans for all units of Siriraj Hospital, as well as other state and private hospitals, using modern techniques in accordance with the ISO 15189, as well as other certifying standards. More than 200 types of lab procedures can be performed at this diverse laboratory. Besides, the lab also serves another two major functions. For example, research and education services. Every week, medical students, physicians, and other medical personnel take turns coming in to study and share knowledge of infectious agents, diseases, identification methods, and diagnostic tests. That is the way of integrating all relevant knowledge that results in a lot of research studies that lead to medical care quality improvement. Meanwhile, it also cooperates with the Infectious Disease Control Committee of the medical school in monitoring the situations of microbial drug resistance and emerging infectious agents in humans, and then provide warnings when an abnormal incident occurs.
เชื้อก่อโรคเชื้อดื้อยาเชื้อที่เกิดขึ้นมาใหม่
Dr. Patala Chai said that this matter is very important and the warning will be issued as soon as a drug-resistant infectious agent is identified to the attending physician and the infectious disease control section through its regular communication channels, so that all concerned can cooperate in the diagnosis and control of infectious diseases for preventing the spread of pathogens. At present, the drug resistance problem is worrisome as antibiotics are widely used. Some of them can be bought by the people for self-medication, resulting in the widespread of drug-resistant microorganisms.
จากการศึกษาเราพบว่านะฮะว่า
Dr. Somwang Danchai Wichit, Professor Emeritus and Advisor, Nosocomial Hospital Acquired Infection Control Committee, Siriraj Hospital, said that the latest survey conducted 2 years ago showed that each year there are approximately 500,000 inpatients affected by nosocomial infections, or 7.4% of all inpatients in Thailand. The case fatality rate is as high as 10%, causing the loss of lives and property, including high medical care costs. Thus, it is very important to prevent and control such infections. The pictures being seen now represent the work of Siriraj Hospital's Nosocomial Infection Control Committee that is comprised of doctors, nurses, and other personnel from all units involved in medical services. Raising awareness of personnel in preventing and controlling hospital-acquired infections is the major duty of the committee to reduce the incidence of such infections for the safety of healthcare recipients and providers. Dr. Yong Long Rung Rueng, Siriraj Hospital's head of the Infectious Diseases Unit, Department of Internal Medicine, said that Siriraj Hospital has established clear guidelines for the control of healthcare-associated infections, with specific programs and systematic operations. To further develop the infection control process continuously, new campaigns will be launched for hospital staff at all levels and solicit their support with a clear policy directive from the administrators. There are many other interesting aspects of the Infectious Diseases Unit. What is being seen here is the hand hygiene campaign through the actions of Mr. and Miss Hygiene. Studies have shown that hand hygiene or hand cleanliness of operational staff is the important frontline action to reduce nosocomial infection. Learning about this matter is required for medical students and medical personnel at all levels, so as to create an organizational culture that enhances close relationships as well as helpfulness and compassion for one another. They all have to remind each other of hand washing before and after contacting the patients or their belongings, as sometimes the healthcare provider might do something rather hurriedly, resulting in getting infected. Dr. Yong Long Rung Rueng, Siriraj Hospital's head of Infectious Diseases Unit, Department of Internal Medicine, said that the clear guidelines of Siriraj Hospital include a policy statement, organizational structure, supplies and equipment, premises and personnel, as well as the standard operating procedures and the monitoring and evaluation process, specifying which practice is suitable for which situation by what kind of personnel. Besides, education and training for healthcare providers is important for effective infection control. Some of such activities are, for example, Siriraj Safety Camp, focusing on helping personnel to learn about infection control methods and apply them at work. This is to help them to understand how to do things consistently and what others do. For all staff, including doctors, nurses, and others at all levels. Visits and surveys of all units in the hospital are essential so as to learn of the problems in infection control. And then an evaluation is to be performed to make adjustments to the action plan of each section, resulting in the rise and drop in nosocomial infections within the controllable limits.
ร่วมมือกันอย่างใกล้ชิดระหว่าง
Professor Somwang said that to control hospital-acquired infections, hospital staff's cooperation is very important, as they have to be knowledgeable about such matter and also transmit the knowledge to patients, and the cooperation of both parties is also important. The development of personnel's capacity to have expertise in infection prevention and control takes about 5 to 10 years for the results to be evident. Although it is time-consuming, the results would be worthwhile. At the medical school, technical principles have to be created and practiced for use in producing competent personnel. Having worked in the past until today and moving towards the future, the Faculty of Medicine Siriraj Hospital has been stepping forward with the aim of further improving service quality in all aspects, developing technical expertise consistently as one of its strengths, according to the determination of His Majesty the King's Father, Prince Mahidol of Songkhla, who is the father of modern medicine of Thailand. The true success of education is the application of technical principles for the benefit of mankind.